It's horrible, right? Well, depression has always been taboo until now. It's for weak people who have no willpower. Oh yes, but willpower is not... I mean, even if you have willpower when you're depressed, willpower, you're not the same person anymore. It annoys me when I hear people say that, because no matter how hard you try, you just can't do it. It's horrible, right? Hello, my name is Patricia. I live in a small town 20 kilometers from Quimper. Right now, I'm 58 years old. So I've always worked in accounting, in an accounting firm among other places. And at 52, I had a major burnout, a severe depression, to put it plainly. As a result, I couldn't go back to work. I was really in a very, very bad state for several years. And my psychiatrist, after several years, suggested I try RTMS sessions.
I'm Stefan Billard. I'm a psychiatrist and addiction specialist at the EPSM of South Finisterre in Quimper. I'm the head of the addiction department at EPSM and also responsible for the RTMS activity within the facility.
That's why I'm here with you today. I've always been quite anxious, but I was also quite cheerful, outgoing, and interested in a lot of things. I don't have children, but I kept myself busy with lots of activities. When I was 52. I think it happened gradually, actually. It was a combination of many things. It wasn't specifically work, there were several factors involved. And then one day I left work and just couldn't do it anymore. I quit my job and was never able to go back. Oh well, it's complicated when you see yourself going down, down, down. And then there aren't many people left around, because when you're not doing well, you tend to distance yourself from others. When you meet someone, they ask, "Hello, how are you?" And when you're not okay, I can't say I'm fine when I'm not, but I also don't want to say that I'm not okay, so it's complicated. We tend to avoid people, and people also, in a way, distance themselves. So it's complicated because you end up with almost no one around you. It's not easy. I had a lot of obsessive thoughts, actually. It was always the same thoughts, like a hamster wheel, if you will. They kept going around and around, and it was impossible to think about anything else. You don't see anything around you anymore. You're so focused on yourself that you don't notice anything else, and you're left with only those same thoughts in your head. And well, you don't see a way out. 2016 is when I got sick, in February 2016. So from February 2016 until July 2020, I took medication. Well, I still do. At some point, the medication didn't seem to have much effect, so Dr. Frank suggested RTMS in 2020. I had already been offered, what's it called? Electroshock therapy, which I always refused. I didn't want it. So when he suggested RTMS, at first I was quite hesitant. But when he explained that it wasn't too invasive, I agreed. And well, I'm glad I did.
RTMS is something that can sometimes be intimidating or at the very least create resistance because people don't know much about the technique. But once we explain to them how non-invasive it is, how easily it can be implemented, and how few side effects it has for the patient, it's actually quite reassuring. More importantly, it's the professionals who see the improvement in patients that have really solidified the legitimacy of RTMS in our practice here in Quimper.
So, with RTMS, they set you up in a chair, put a cap on your head, then a headband and a coil. In front of you, there's an image of your brain with the specific area marked where the electrodes will work. So it creates a small circle on the brain at the spot where it has an effect, and it's, what's it called? The prefrontal cortex, I think.
Transcranial magnetic stimulation, RTMS, is a stimulation technique, magnetic, not electrical, meaning we stimulate neurons using a coil, but not just any neurons. We target a specific area of about 2 square centimeters. For treatment-resistant depression, we stimulate the dorsolateral prefrontal cortex, either on the left or right side, depending on the protocol. And the stimulation is applied repeatedly. One session alone doesn't have lasting effects, so we need to repeat sessions according to the protocol between 10 and 30 times to see a clinically observable effect.
From the very first session, I felt right away that it did something. From the first or second session, it's like, it sounds strange to say this, but when you're depressed, you're in such a bad state, it feels like you only have 2 neurons left, like there's no communication between them anymore. When you're depressed, you can't think properly, you have nothing to say, you don't notice anything around you. TV just goes over your head, the radio, same for me, it just went over my head, and then it was like, poof, the neurons reconnected. It sounds unbelievable, but that's exactly what it felt like. Oh, there are way more benefits than downsides, because honestly, there aren't many downsides. For me, I just have to go to Quimper. It's a 20-minute drive, so that's not really a problem, no.
We've been analyzing the effectiveness of RTMS in patients treated at EPSM, and we found that it leads to an improvement of more than 50% on the Beck 21 item scale, along with clinical evaluations showing symptom relief. Overall, we see an improvement rate of about 65 to 70% in patients.
Oh, it's a complete change. My life has changed. I'm getting my old life back. I want to do things. I can organize my days again. I want to be active. I do gymnastics. I've met new people. That's impossible to do when you're depressed. Completely impossible. You have to try. You have to try. As they say, nothing ventured, nothing gained. But I really think you have to give it a chance. There are way more benefits than downsides. So if it's offered, you should try it. It's really worth trying. Of course, I wish I had been offered RTMS right from the start, at the beginning of my illness in 2016. It would have prevented a lot of things that went wrong in my life. But you can't change the past. That's why if someone is offered this, I say go for it. Don't hesitate.